Good morning and welcome to Webinar Wednesdays with SMP. We're glad to have you all here with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs. I'm going to be your host for this morning, and presenting for us today will be Brenda Mallara, who is a community outreach specialist for us in Louisiana, and Keith Havens, who is our media outreach specialist. Today, for the October installment of Webinar Wednesdays, we're going to talk about open enrollment fraud and scams. During the presentation, you're welcome to type in any questions you might have into the chat, but we're going to hold those until the very end of the presentation when we open it up to question and answers. There will also be a prize drawing at the end of the presentation. You must have been registered to attend the webinar prior to 10:15 a.m. this morning in order to have your name entered to win. Before we get started, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are an endorsement by ACL, HHS, or the U.S. government. So if this is your first time ever joining us for Webinar Wednesdays, we want to give you a little bit of information about who is Senior Medicare Patrol. Well, SMPs are grant-funded projects, like I said, from the U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and their caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before we get into the types of fraud and scams that can occur during this time, during the open enrollment period, let's take a look at some very important dates. Every year, it's important for you to review your Medicare health and drug coverage and make changes if your plan no longer meets your needs, or to see if you could lower your out-of-pocket cost. The time to do this is during open enrollment. This chart, with some information taken from the Medicare and You book at medicare.gov, shows you some key dates that you need to remember. During the month of October, it's a great idea to start comparing your current coverage with other options. You may be able to save money or get extra benefits. You could visit medicare.gov/plan compare for help in doing this, or you can contact your local SHIP, which we will share information on later during the presentation. From October 15th through December 7th, you can change your Medicare health or drug coverage for 2024 if you want to. You can join, switch, or leave a Medicare Advantage plan or a Medicare drug plan during this open enrollment period each year. On January 1st, your new coverage begins if you made a change. And if you stay with your existing coverage and your plan's cost or benefits changed, those changes will also start on January 1st. Also, from January 1st through March 31st, if you're in a Medicare Advantage plan, you can change to a different Medicare Advantage plan or switch to original Medicare, once during this time. Any changes you make will be effective the first of the month after your plan gets your request. And you want to remember that Medicare Advantage plans change each year, so it's really important to make sure your plan is still the right fit for you. During open enrollment, you can stay in original Medicare or join a Medicare Advantage plan. If you're already in a Medicare Advantage plan during open enrollment, you can switch back to original Medicare if you choose to. So we do have a quick polling question for you today, and that question is, have you ever received phone calls from companies trying to sell you a Medicare health plan? Let's see, let me launch the poll. There we go. So have you ever received phone calls from companies trying to sell you a Medicare health plan? Yes or no? And I'll give everyone a few seconds to go ahead and lock in your response. Okay, it looks like about 85% have voted. I'll give you just a few more seconds. Go ahead and lock in those responses for us. All right, we'll go ahead and close it out and share. It looks like 82% said yes, you have received those phone calls, and 18% said no. So now I'm going to turn things over to Brenda, who is going to um, talk about why these types of calls tend to increase during this time of year. Brenda?
Thank you, Sunny. Okay. So now that we have an understanding of the basics for this year's open enrollment period, let's talk a little bit about how unethical individuals may try to defraud you, the beneficiary, during this important period. During open enrollment, you may see advertisements on TV or the internet, or even receive phone calls from individuals all trying to get you to switch to a new Medicare plan. It's important to do your research and choose the best plan for your own individual needs. Medicare enrollment can feel complicated and confusing, and unethical salespeople may use that to their advantage to enroll you in a plan that is not right for you. And remember that Medicare plans are not a one-size-fits-all approach, and what may be the best plan for others may not be the best plan for you. And I just want to add also that I've gotten reports of people getting text messages too. So it's not just the phone calls now or the TV or the internet. You have to be careful. It's also email and text messages. Next. So, excuse me. So as open enrollment approaches, we here at Senior Medicare Patrol, or SMP, we see a significant increase in scams targeting Medicare beneficiaries. Let's talk about some illicit activities by marketers or scammers that you all should be aware of. Phone calls claiming to be from Medicare or the federal government asking you to verify or update your Medicare number. Also, an agent using misleading or high-pressure sales tactics to get you to enroll in their plan. Just remember that you should never let someone intimidate or scare you over the phone like that. There's also someone offering you cash or gifts in exchange for switching your plan. Next. There's also representatives that come to your door uninvited or call you if you are not already a member of that plan. Someone trying to charge you for a fee for enrolling you into a new plan, and then emails or solicitations in the mail from companies offering Medicare plans. All of these are examples of open enrollment fraud, and you have to be on the lookout for that. Next. There are several ways that you can protect yourself from open enrollment fraud, including hang up the phone if you receive a phone call from someone claiming to be from Medicare or Social Security. Remember, Medicare and Social Security never calls you. Other times, these callers will claim to be from something along the lines of senior benefits or names like that to confuse you. Never give out your Medicare or Social Security number. Remember that. Also, do not engage with door-to-door salesmen. This tactic can be particularly prevalent if you live in a seniors-only community. This is not an authorized way to sell Medicare plans. Be wary of calling phone numbers you may see on advertisements such as those on TV or the ones you receive in the mail. While these advertisements themselves are not illegal, the person on the other end of the phone may not have your best interest in mind and what plan is best for you. It is best that you get your advice from an unbiased source. And then by getting help from a trusted source, you can also protect yourself from open enrollment fraud. We'll talk more about those trusted sources on the next slide. Next. We suggest two methods to find unbiased advice about what Medicare plan is best for you. Number one, using the Medicare Plan Finder on www.medicare.gov. Please make sure that you're on the official Medicare.gov website and not a website pretending to be Medicare.gov. Those would be the ones with extensions like .com or .net or .org. It's always .gov. Or those who think that they need more assistance to make their Medicare selections. For example, always contact your state's SHIP program. SHIP stands for the State Health Insurance Assistant Program, or it can stand for the Senior Health Insurance Information Program. This is a sister program to us at SMP. These programs are also nonprofits funded in part through government grants. SHIP programs are designed to provide Medicare counseling to discover which plan is best for you. These counselors do not work on commission and help the seniors make informed decisions by providing free and unbiased guidance via telephone or face-to-face interactive sessions. Next. So now that you have learned about open enrollment fraud and where you can go get help for your Medicare selections, Keith is going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse. Those keys are prevent, detect, and report.
Brenda, I think we might have missed a slide on how they can contact their state's SHIP program.
Oh, I'm sorry.
That's okay.
Yes, we did. Okay, so how do I go about contacting my SHIP program for trusted, unbiased advice? So every state in Puerto Rico, Guam, and the US Virgin Islands, they have a SHIP program to give the seniors unbiased assistance in making their Medicare selections. However, the contact number and organization that runs the SHIP program varies for each state and territory. For the states we serve, Georgia, Louisiana, and Mississippi, the contact numbers on your screen are as follows. In Georgia, the SHIP program can be reached by calling 1-866-552-4464, and then you press option 4. In Louisiana, the SHIP program can be reached by calling the Louisiana Department of Insurance at 1-800-259-5300. And in Mississippi, the SHIP program can be reached by calling the Mississippi Department of Human Services at 1-844-822-4622. If you know someone who needs assistance in another state or territory, perhaps, you can utilize SHIP's official national website at shiptacenter.org and clicking the Find Local Medicare Help button at the top right corner for that state or territory under the SHIP's contact number. And now we're going to the 3 keys. Keith is going to help us understand that. Keith?
Thank you, Brenda. So the 3 keys that we always stress in fighting fraud is prevent, detect, and report. So let's look at the first one, prevent. It's just basically when we are talking about preventing fraud is protecting your personal information. You know, the old saying goes, an ounce of prevention is worth a pound of cure. It's a lot easier to stop Medicare fraud by preventing it than trying to prosecute it after the fact. So what we always tell people is treat your Medicare and your Social Security numbers like you do your credit cards. So why do scammers want your Medicare numbers? Why is that the object of their scams, is to get your number? Well, in order to perpetrate fraud, they need two numbers. They need a Medicare beneficiary's number to charge to that account, and then they need a provider number. So unfortunately, there's plenty of unscrupulous providers out there that they can use, but they really need your Medicare numbers in order to charge Medicare. So it's very important that you never give out your number over the phone, and that includes your Social Security number. Again, just like Brenda told you, Medicare and Social Security and the federal government, they're not going to call you and ask for your numbers. They know who you are. They don't need you to verify their number. Plus, you need to understand that the way the federal government contacts you is almost always through a letter. So we suggest that you don't carry your Medicare card. And now I know the first question that's going to pop into your mind is, well, what happens if I'm out away from home and I get into an emergency situation? Well, you need to understand that every emergency room in this country is required to accept any kind of an emergency patient. So you're not going to have a problem getting into the emergency room, and then later down the road, you can give them all your information, your Medicare number, and all that. So don't be concerned that if you don't carry your Medicare card, you may be in an emergency situation where you're going to need to show it. So you're covered on that. And again, just to reiterate, Medicare is never going to call you. So if you do get a call and they claim to be from Medicare, just hang up. That's the best course of action that you can take. And we also ask that you keep a good record of your medical visits. And we do have a healthcare tracker. If you would like one, you can get one. But just keep a record. You don't have to get into a lot of details about what happened, but just so this will allow you to do the next key that we stress, and that is to detect Medicare fraud. So why we want you to keep a record of your medical visits is that we want you to review your Medicare summary notice or your EOB, your explanation of benefits, if you're on a plan that's from an insurance company. So what we ask that you do is to look over your statements and just check off to make sure that, yes, I saw this doctor on this date, or I went to the hospital on this date, or whatever it is. So what we want you to look for is any kind of charge that's for anything that that you did not get, or look for billing for the same services or supplies that you see more than once. It could be just a simple error that they process that charge or that billing by mistake. They duplicated it. Or if you see any kind of services that were not ordered by your doctor. Now, the third and the final key is to report. So let's say that you looked over your MSN and you see something that doesn't look right, or you receive a call that that they claim they're from Medicare or whatever. We want you to report this to us. This is why we are here. We're here to as a resource for you. And the first thing we ask that you do is call the provider. If it is a charge on there that you don't think is correct, then just go ahead and call your provider, your doctor or whoever it is, and just say, I have a charge on here. I don't really think I should have been charged that. Now, if they can't resolve that, or they won't, or there's still a dispute, then you can call us and we will start handling it from that point. And on the screen, you can see we have a toll-free number, 877-272-8720. And we also have a website where you can get our contact, our email, and that is www.stopmedicarefraud.org. Now, you may be thinking, well, okay, what else can I do to help fight fraud? Well, we would love for you to consider volunteering. So the benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. All of our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible, and it's done on an as-needed basis. Volunteers are offered opportunities to have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we have had couples team up to volunteer, give presentations, and attend community events. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, and Sunny, you will be talking to Sunny, and she would be more than happy to send you our information and to answer any question that you may have about the process. So on the next slide, this gives you some of the information about how to contact us. If you want, we do have Facebook pages for every state and a Spanish Facebook page. We also have a YouTube channel, and we have a podcast that Brenda is involved in called Sip and Learn with SMP, and that's on Spotify and Apple Podcasts. And you can find all of this if you want to. If you can use that QR code that you see on the screen, and the way that you access that is you take your camera on your phone and you just point it at that, and it'll bring up a link, and you just touch that link, and that will open up the all the links to all the things I just talked about. And I think with that, now I'm going to turn it back over to Sunny.
Thank you, Brenda, and thank you, Keith, for that information. I also do just want to mention real quick, Keith mentioned our YouTube channel, and all of our Webinar Wednesdays are posted and shared on our YouTube channel. So if we ever had a topic that you were unable to attend the day of and you missed it, you can go back to our YouTube channel and you'll be able to watch it. And we'll have this one added to it a little later today as well. So coming up next month for Webinar Wednesday, we're going to talk about scams, not just general scams, but we're also going to talk about those holiday scams. We're going to be getting into Thanksgiving and Christmas, and all kinds of things are happening, and scammers really like to use that time of year or this time of year to perpetrate fraud. So we're going to talk about all kinds of things that you can be on the lookout for year-round, but also during the holidays. So that webinar is scheduled for Wednesday, November 29th at 10:30. So just be on the lookout, and I will send you the invitation when the time comes. So now it's time for our prize drawing. Everyone who was registered to attend prior to 10:15 a.m. this morning has been entered for a chance to win, and you must be present. And you will receive your choice of a $25 Walmart or Amazon gift card. So I'm going to go ahead and open up our prize wheel and our list of attendees so I can see who's on. All right, we're going to click on it and give it a spin, and hopefully we'll have a winner here this morning. All right, it looks like Nancy M, and I'm not seeing Miss Nancy on here, so we'll try again. All right, it looks like Miss Catherine, you are our prize winner today. So Miss Catherine, I'm gonna reach out to you a little bit later today and find out what gift card you want, and we will get that as soon as possible. All right, there we go. So Miss Catherine, I think I might have lost my audio. So I did say that I will be reaching out to you a little bit later this afternoon to find out what gift card you want, and we'll get that out to you. All right, so before we wrap up today's presentation, I do want to see if anybody has any questions about the material that we presented. So if you have a question about open enrollment fraud and scams, please feel free to raise your hand on the GoToWebinar control panel. I can unmute your line and you can ask us your question if you'd like. Okay. Well, I'm not seeing any hands raised, but we've given you all of our contact information. So if you think of something after the fact, please feel free to reach out and let us know. This will conclude our presentation today on open enrollment fraud and scams. We will send an email after the webinar with a link to a short survey, and we would really appreciate it if you would take just a few moments to complete that survey to let ACL know how we did today. We appreciate you joining, and we hope to see you again for one of our future webinar Wednesdays with SMP. Thank you, and continue to have a great week, and we will hopefully see you again real soon. Thanks, Brenda and Keith.
Thank you all.